Hello, my name is Gage Clow, and I will be talking today about the three most important things to know about HIV. So, starting out, just to clarify what HIV is in general, it stands for Human Immunodeficiency Virus, and if left untreated, it becomes Acquired Immunodeficiency Syndrome, also known as AIDS. And once you have HIV, you have it forever. It can't be cured in any way, but it can be treated with retroviral therapy. So before we get into what I find important to know about HIV, we should kind of talk about like the brief history of it within the United States. So basically, it's widely believed to have originated in the Democratic Republic of the Congo. At some point, there was a cross between chimpanzee and human that caused it to become within the human race in general, and it was first noticed in America when Kaposi sarcoma and pneumocystis carinii pneumonia started spiking in the gay community, and everyone was kind of wondering what was going on. Why are gay men specifically at risk for these things? So in 1982, it was coined GRID, with a gay-related immunodeficiency, and it kind of went on like that for a few years until it was renamed HIV because of the fact that it was noticed that it was in heterosexual populations as well, just at lower rates. And celebrities such as like Rock Hudson and Irvin Magic Johnson, who's a basketball player, and Freddie Mercury, the lead singer of the band Queen, all have said that they have HIV or AIDS, and that was kind of a big deal in terms of people in America starting to sort of shed the stigma that it was just for gay people. And yeah, I think in 1997, the easy retroviral therapy, at least easier, was created. It was called Combivir or Combivir, and it was the first drug that properly treated the replication of HIV within the body. And it's kind of been ever since then pretty stagnant up until 2010, when pre-exposure prophylaxis was shown to be a great way to lower risk for people who are HIV negative but are exposed to people who have HIV. So after all that, I have to say that the first most important thing about HIV that you need to know is that it disproportionately affects specific minority communities in America. So basically, the highest infection rate of HIV is in black men who have sex with men populations. This is mostly because of the fact that there's a lot of stigma surrounding the disease and a lot of stigma surrounding medical treatment. So black men who are gay tend to avoid seeking treatment and proper care for their needs, and it became prevalent in the gay community during the late 70s due to unprotected sex practices and no knowledge of the disease. So gay men basically thought that they were fine to have unprotected sex because there was no risk for pregnancy, and at most there was risk for some sexual infections, but nothing as serious as HIV. So no one really knew, so they were going out and having unprotected sex anyway. And additionally, black heterosexual women also experience relatively high rates of this. Rates are low in Asian American and Native American populations, and this is likely due to lack of exposure in terms of both crossing cultural and race lines in America, as these groups often do tend to cluster together. Deaf people and other disabled people actually also experience high rates due to lack of trust of their able-bodied counterparts. So deaf people specifically often view themselves as a very specific community, and so they do not seek treatment in the way that you would expect them to. And drug users as well, because of unsterilized needles. So the second most important thing to know about HIV and AIDS is that it's the second leading cause of death in lower income countries. So behind only lower respiratory infections, HIV and AIDS causes 65 deaths per 100,000 people in lower income countries as of 2012. And this is likely due to the fact that expensive treatment exists and that there's lack of access to medicine in the community. So often it can be transmitted through birth and breastfeeding and things like that. Um, it's also there's also high rates of sex work in lower income countries, often due to the lack of infrastructure. So that can also be a great and a very easy way for HIV to get around. The third most important thing to know is that the stigma surrounding HIV is often the main drawback in terms of understanding exactly why it continues to be such a largely spreading disease. So basically, HIV was known as the gay disease when it first came to America. And this tends to stop heterosexual men and women from seeking treatment as they're afraid of judgment from their peers or their doctors or things like that. And it also stops teenagers from being able to seek treatment due to their parental concerns. And this idea that HIV and AIDS in America is only for gay men is very, very dangerous. It leads to a stagnation of cases in which new people get HIV. So yeah, that's basically all I have to say on the subject, but thank you so much for watching, and have a great day.